to Doctor and Doctor. I'm Pastor Mark Strong, pastor of Life Change Church, and I'm here with Dr. Jill Ginsberg from North by Northeast Community Health Center. Wonderful organization here in North and Northeast Portland that has been on the front lines for a number of years, ensuring that African Americans can have good health care, affordable health care, homegrown right here in the neighborhood. So we sure appreciate you, Dr. Jill, and the good work that the clinic's been doing for all these years. So we've been coming on. This is our second conversation where we've had talking about the COVID virus and how that's impacting all of our lives. As I said our last time together, that all of our lives have been impacted immensely. I know for us as a church, we haven't met together in a building since March. And so it's turned our life upside down and the way that we do things upside down. And I'm sure for those of you that are watching, your lives have been impacted as well, too. So hopefully some of the things that we can share will just kind of give you a little bit of understanding about what we're dealing with and help you to kind of understand a little bit more about just some of the aspects of it and why, testing or masks or these different types of things are important. And so today, Dr. Jill, let's talk a little bit about testing. I guess let's start, maybe like why it's important and, what kind of test, what the tests are, what does it require people to do, and so forth.
Yeah, so testing is a big topic and a very, very important topic as far as COVID-19 goes, because with an illness that is so contagious, it's really important to find out where the illness is spreading in the community so that we can take the necessary actions. And coronavirus lives in our respiratory tract, our nose, our mouth, our airways. So the way that most people get a test is with a swab into the back of the throat. It's a little bit uncomfortable. It goes through the nose. It takes about 3 to 5 seconds, but it's probably not going to be your favorite 3 to 5 seconds of the day. But it's not, it's not horrible. It's uncomfortable. It's a swab going down there. It feels a little ticklish and what that does is it tests for presence of the virus in your airway. So the testing that we have is really divided into two big categories. One kind of test checks for the virus. The other kind of test checks for what's called the antigen, which is, the antibody, which is our body's defense against the virus. So if you have an active infection, if you're sick today with COVID-19 and we do a swab, it will be positive for the virus particles. They are living in your throat and we see them in the test. If you were sick with COVID in, say, May, your body has developed antibodies to the virus. That's part of the way our bodies fight infections. And there are tests that can detect these antibodies that can tell us that a person was infected before. It doesn't say that you're infected now. It doesn't say how long you're going to have these antibodies. And there are a lot of things we don't know. It would be great to know, I say I had COVID-19 in May. I've got antibodies. That means I'm never going to get it again. And I can do whatever. I can travel safely. I can work without having to wear a mask. I don't have to worry. We don't know that at all. That's not where we're at. What we do know is people do develop a certain level of immunity or antibodies to the coronavirus after they've been sick, but we don't know how long it lasts or how protective it is. So that's all very important. But most of the testing that's being done is the testing for the virus itself, active virus particles. And that's important because people who have active virus particles in their throat, in their nose, in their mouths, in their airways are spreading those particles every time they breathe, speak, sing, shout, anything. And more voice you're using, the louder your voice, that the more virus particles are being spread. If you've ever been sneezed on, you know what it feels like to have, someone spread their own mouth particles onto you. And very pleasant. We do the same thing to a lesser extent when we cough, for sure, but also when we sing and even when we talk. So right now, the particles that are in my airways are coming out. They're not, you're not getting them because we're on Zoom here. But if we were face to face, it could be dangerous. And that's why we would be wearing masks if we were in the same room. So the testing can show a person who's infectious, which means they have the infection and they can pass it to somebody else. They're contagious. And that's important because if we identify 3 people, for example, in a workplace that all test positive, we know everybody else in that workplace is at risk. In a prison, for example, testing people shows that, there are people in the prison who have coronavirus. It's very hard to isolate and keep people safe in a situation like that. And there are other settings where people are close together, nursing homes, lots of people working in close quarters together. So if we identify the people who are infectious and have them stay home, we can prevent the spread of coronavirus. One of the things that's happening now that I'm so concerned about is there are a lot of reasons that people don't want to get tested, even if they think they have coronavirus. And they're good reasons. People don't want to be sent home from work for 10 to 14 days if they test positive. We've already seen an unprecedented economic crisis in our country. Mm-hmm. So many people are struggling. And if they have to miss another, 10 to 14 days of work, that could potentially be financially devastating.
Yes.
So, and the same with school. People don't want their kids tested because they don't want a kid who, in the places where schools have opened for in-person instruction, people want to be able to send their kids and so that they can work, so they can, have their lives, and so their kids can get the benefits of school. But people are afraid to get their kids tested and find out they're testing positive and they're going to be kept home from school. We don't have the supports in our society, in our communities here in Oregon, in Portland. There are some, but we don't have enough supports for people to feel safe getting tested and then knowing that they will be helped through the crisis. If you have to stay home from work, we're going to pay you to stay home, so you're not going to lose out on your income. And that's been a really serious problem. In Portland, there is a paid leave if you are sent home from work because you've been exposed to someone with coronavirus. You can get up to $120 per day for 10 days if you have to stay home. And that's a help, but that's not available to everybody. And, there's a lot of fear out there about the consequences of getting tested. And, on the other hand, the consequences of not getting tested are that this thing is going to just go on and on and on and continue to spread in our community and other communities around the country.
Dr. Jill, when would you recommend a person to be tested?
So anyone who has any symptoms of coronavirus, of COVID, which I can go over, should be tested. And that would be a new cough, a new loss of taste or smell, okay, a fever, headache, a new headache. So those are, sore throat, severe sore throat. But definitely, if you have any of those symptoms, you should talk with your healthcare provider about getting tested. And then there are some other categories of people. If you've been exposed to someone who's been known to have COVID, you should talk to your healthcare provider about getting tested. If you've been exposed in the workplace or in some sort of congregate care setting, you should talk to your healthcare provider about getting tested. And there's been a lot of the testing has not been as widely available or as easy to get as it should be, as we were told it would be. So it's been hard to get tested. And I've had patients who are concerned. They've had this symptom or that symptom, and they don't fit the criteria for getting tested because they don't have the right symptoms and, can't get tested. So I think in the future, testing will be more available, and we'll be able to, test at home frequently. I think that's coming, but it's not here yet. And people, I think the message I want to give is, if you're concerned, talk with your healthcare provider about whether testing is appropriate, and don't be afraid to get tested. We're counting on each other to get this under control. And that's a really important part of it.
I think one last question, Dr. Jill. So if a person, they go get tested on Monday, what's typically the turnaround time to find out if a person is either tested positive or negatively?
Well, that's a very good question. I wish there were a simple answer. It should be, 24 to 48 hours. But we have seen delays in getting the results I had a patient who waited 2 weeks for his test results. And that's very difficult, because you're isolating at home while you're waiting for your test results. And the other thing to remember is, I can go today to get tested, and then on the way home from the test, I stop at, maybe I stop at a restaurant, have a meal, and I'm sitting next to someone with COVID, and I get infected before I even get home. But that test isn't going to show that.
Yeah.
So the test is kind of like a snapshot in time. It doesn't mean you're in the clear for, going forward. It just means, as of this moment, we don't see any active virus in your respiratory tract.
Okay. All right. Well, we've covered testing a little bit today, so hopefully that kind of lets us know that testing is survivable. I've talked to a couple of people. They're like, "Oh, Mark, they take this swab, they stick it, up your nose, and it goes back. It's the most uncomfortable, painful thing, but it is survivable." So Dr. Jill's told us, it may be a little ticklish because you're not used to being, touched in those areas, but it's survivable. And basically what the test is checking for is the virus particles in your nasal passages, and then also antibodies that your body has been producing to see if you have, perhaps in times past, have had the virus. So want to encourage you that if you need to be tested, and some of the indicators that Dr. Jill had given us was, if there's a new cough, if there's a loss of taste or a loss of smell, then you may want to talk to your care provider about the possibility of doing that. And by all means, we understand the difficulty and how hard it is right now just to survive with all the economic challenges that are there. But we do want to tell you that, your life is a lot more precious than the money. And, it's better to live today and tomorrow and have to struggle a little bit than not be here tomorrow because of fear of not being able to have the means that you need. But there are some resources out there. We can try to maybe put a list up, maybe do some research, and on our end, and we can maybe put a list up of some places that may be able to call and help, because we do want to support you, and we want to let you know that you're not alone by yourself in this, and that you're going to get through it. We're going to get through it. So thank you for watching us today on Dr. Doctor. In the little comment box there on Facebook, if you have a question or a comment, feel free to put that there. One of our programs, we can perhaps talk about that. Again, we're not trying to be political, or we're not trying to drive a particular point across. Our goal is just we want to help people, and we want people to be safe. We want people to be healthy. So thanks for tuning in today. Thanks, Dr. Jill. And we'll see everybody again next time on Doctor to Doctor.
Thank you.
Bye-bye.